Thank you so much for attending today's International Press Conference and Products Launch produced by Taiwan Excellence.
Ladies and gentlemen, please welcome Mr. David Chen. Thank you.
The exporting of Taiwan's medical devices to the United States increased 10.93%. Over the last few years, Taiwan has made remarkable advancement in the research and the development of medical and surgical solutions.
Dr. Antonia Novello.
As you are aware, medicine is always changing and absolutely challenging. Our presenters today have been instrumental in developing products with the purpose of advancing science. We have the inventor, Dr. Wong, who will truly present how he has combined mixed reality technology with surgical navigation, similar to the GPS system, to visualize in high-definition resolution the tissues images of the patients that you're operating on.
The technology, this is the galaxies what we developed for surgery. And there are several sensors. Actually, we attach 4 different patent sensors. That surgeons, during surgery, those 4 sensors can detect the position, 3D position of the patient movement. The surgeons, they wear the glasses, they can see those inner organs. They don't need to open it, but they see the virtual image attached on the right position. So this is the technology. And for the surgeons, I think it's most important benefit, I think. Surgeons, they take a lot of radio exposure during surgery. So this is why this technology, every orthopedic surgeon and neurosurgeon, they see, just take the technology, let me use it now. So I'm thinking for surgeons, it's a better outcome.
Are you going to have some kind of a training regarding how to use these glasses and the complications that might come by utilizing them without knowing how to use them correctly? Are you going to have some kind of a training for this?
Of course. My company, we are getting started to construct those teams, especially we say after sell the product, we have to design a clinical education procedures that the surgeons, that before to do real surgery, real surgery, they have to have a course, even 2 or 3 days. Then they can learn how it works with dummy. Then after that, then they can go into the real surgery. So this is our design system. We have that surgeon have to do this kind of education first.
Since the surgeon doesn't have to move or switch between patient and monitor, absolutely the beauty of this technique is that it's going to diminish the amount of time in a patient's operation. The MCAT will allow for the accurate visualization of the characteristics of the thyroid nodule. This detection technique will aid and will advance and increase the quantification and the visualization of the characteristics of the thyroid nodule. By doing this, it will advance the detection of the nodule, which I think is excellent in the sense that it will make sure that you can diagnose for the first time whether it's malignant or not malignant. And you will diminish the utilization of the fine needle biopsy by 50% and the thyroidectomies by at least 30%.
Thyroid cancer. Several years ago, in Taiwan, National Taiwan University Hospital, there are many surgery doctors. After they cut the surgery organ, they found about 50% are benign. That means not cancer.
With MKUT, we have several advantages. For patients, we can avoid unnecessary FNA and unnecessary surgery. We also provide non-invasive detection. For doctors, they can increase their accuracy and also save their time. We can generate report easily. For hospital and the government, we can reduce their cost and also reduce their resource. They can avoid unnecessary surgery to reduce their budget.
You can see this on screen, block A or block B, which one is darker? It's almost the same. Why? Because of the light, because of the angle, because maybe you are tired. Still, AI cannot replace the human. This is a detection tool to help doctor. Doctors still make a final decision. So if they use MKUT, they can avoid unnecessary FNA and unnecessary surgery.
Finally, we aim to avoid 50% unnecessary FNA and 30% unnecessary surgery.
Your invention will be unique in making sure that some women will not suffer about this. So I congratulate you, Dr. Lee.
Thank you.
With this particular mattress, the Domus 3, they will be able to utilize the deflating and the inflating pressure of this mattress with an effect that will be balanced and will relieve the pressure in the decubiti ulcer of these particular patients. Think about patients that are basically in bed forever. Think of people with spinal infections and in spinal inabilities. Think of people who have problems with their skin. They will be in a place in where the pressures will be removed. Think of diabetic patients.
In the hospital, they will develop pressure sore in the hospital. Like, it can be some year 160, some year can reach about 200 ulcers cases. And immediately on the first year, they use our mattresses, and it reduced to 90 cases. And for them, it's a very exciting news because, you know, when you don't treat the ulcer, it can lead up to very complicated situation. And to cure a pressure ulcer is much more expensive than you're able to prevent it. So we provide supporting surfaces that can help to reduce the pressure sore. Pressure sore has such a different factors, and mattresses are here to alleviate some of the factors and to compensate with other treatments. If you talk about treatments, it's like medicines, it's like NPWT, negative pressure wound therapies. So it's a holistic part of the treatments to improve the quality of life.
The Domus 3 is an excellent way by which you are going to avoid the possibility of these decubiti ulcers. It will also help the medical personnel when you have to change dressings for patients, that my nurses will know how difficult it is to move patients, that you will be able to position them and change the dressing without really making them too difficult in the position. Thank you so much for coming from Taiwan, and thank you for this afternoon.
Of these innovations from Dr. Wong, Gustavo, and James, this is really amazing, and you know you're contributing to improving the quality of life of everyone. So thank you so much, gentlemen. It's truly appreciated. Thank you.